Waldenström's macroglobulinemia is an indolent non-Hodgkin's lymphoma. It's an interesting disease that shares many features of mature lymphomas as well as plasma cell dyscrasias. Waldenström's macroglobulinemia falls under the umbrella of non-Hodgkin's lymphoma because it's a disease that's made up of B cells, much like many lymphomas that we see. And morphologically, when we look in the bone marrow of patients who have this disease, there are mature B cells, much like the cells we see in lymphoma patients, but we also see plasma cells. These are cells that we would normally see in patients with multiple myeloma. And there's also cells called lymphoplasmacytic cells that fall in between the two, and so they have features of both. The way the cells in a patient with Waldenström's differ is that typically in a lymphoma you'll see one type of B cell, that being a mature B cell. But in Waldenström's patients you actually have a smorgasbord of B cells. You're going to have those mature B cells that you see in lymphoma patients, but you're also going to see these lymphoplasmacytic cells as well as plasma cells. And plasma cells are the cells that we normally see in multiple myeloma patients. So the difference is that you're going to see really the spectrum of cells. In deference to lymphoma patients, most of the disease in patients with Waldenström's tends to be found in the bone marrow, much like we would see in somebody with multiple myeloma. It's very important for one to remember that although this is a lymphoma, it differs because it also makes the IgM protein. This protein can cause many of the disease manifestations. In fact, maybe up to half of the disease manifestations that we see in patients with Waldenström's are because of the IgM protein that's produced. The IgM protein, if it's in great excess, can make the blood very thick. This can lead to what we call hyperviscosity syndrome, where you can see blood vessels begin to crack and you can see bleeding. This can lead to loss of vision. It could lead to headaches. It could lead to nosebleeds. But also, in deference to what we see with the other types of immunoglobulins, the IgGs and IgAs, for instance, IgM can also attack various structures of the body. And so it can attack red blood cells and cause hemolysis. This is a bursting of the red blood cells. It can attack the nerves and cause neuropathy. So there's really a lot of mechanisms by which the IgM can inflict pain and suffering on patients. And that's why it's important to keep IgM in mind when one is looking at the patient, trying to determine symptoms, but also keep it in mind, as you're trying to see if a drug is particularly effective. You really want to see the IgM going down because it can cause a lot of manifestations of disease.